presentation ready for you guys. This session is going to be focused and it's going to be made in 3 sections. On the first section, I'm going to talk about us, about Do It Bariatrics, about who we are and what we do. On the next part of the session, I will explain a little bit about bariatric surgery, the different types of surgeries available. And on the last part of the webinar, I'm going to be answer all the questions that I'm assuming you guys must have. So I'm going to get started right away. And thank you everyone for joining us. Another piece of information is important to provide. All the people that are attending this webinar are going to get a courtesy of $250 that it's going to be credited toward your surgery. So if you decide to go ahead in surgery with Dr. Valenzuela through Do It Bariatrics, the price that we quote you is going to have a $250 discount. This discount is going to be applicable if you decide to book your surgery today, regardless of when it's going to happen, because this is medical tourism and a lot of people just book their surgery in advance. But it's something that's a courtesy and thanking you for attending this webinar. Okay, so I will get started right away. Like I was saying, at the end of the session, I'm going to be opening for a little Q&A session. So if you have any specific questions, feel free to type it on the chat section of this webinar. Okay, a little bit about, like I was saying, about who we are. We are Do It Bariatrics. Do It Bariatrics is a multidisciplinary group that it's led by Dr. Luisiana Valenzuela. Dr. Luisiana Valenzuela, it's one of the most respected bariatric surgery in the field of bariatric surgery and medical tourism, not only in Tijuana, but also internationally. Dr. Valenzuela has been performing bariatric surgery for 15 years now, and she has under her belt more than 10,000 successful bariatric surgeries. Do It Bariatrics, it's like I was saying, it's the company led by Dr. Luisiana Valenzuela. Do It Bariatrics assistance is only since 2024, but the expertise and the experience from Dr. Valenzuela goes way beyond that. Dr. Valenzuela used to be head surgeon for a different medical tourism company, but since 2024, she decided to start Do It Bariatrics. So she's going to be able to provide a more customized experience for each patient. One of the main policies that have changed with Dr. Valenzuela and now with Do It Bariatrics and her own company, it's the fact that she limits her practice to 1 surgery per day. And this is so she and us, as the rest of our team, are able to provide you with a customized experience and are always available to you. And our goal and our main goal is to provide what we call the VIP patient experience. The VIP patient experience, or what we trying to accomplish with this, it's that we understand that medical tourism can be very, very stressful. Especially since you're going abroad to a different country, and the fact that this is a country where it's a different language from you guys. We speak Spanish here in Mexico, but we have a team that is comprehended by professionals, medical professionals and logistic professionals and medical tourism professionals as myself, that we are able to speak English and we have the whole experience to provide a stress-free experience for you. Tijuana, the place that we are, or the city that we are, it's the border city with San Diego, California. So it's a very accessible city for medical tourists because we are very close and we have a proximity to San Diego Airport. So every time that you want to get to Tijuana, the easiest way is just to fly to San Diego Airport, making this for you guys, especially if you're from the US or from Canada, a very short flight in most of the cases, and it's a domestic flight almost every time. So that's what we mean about the VIP patient experience. And the VIP patient experience, it's possible due to the policy of Dr. Valenzuela to limit just one surgery per day, except when we have groups, but those are on special occasions. All of the staff from Do It Bariatrics, we are fully bilingual, so you don't have any language barrier problems or communications. The hospital that we use, it's Blue Medical Tower. It's also a hospital that it's been designed specifically with medical tourism in mind. So all of the staff, the medical staff from the hospital, also the nurses and the doctors from the hospital, they all speak English. But regardless if you have any kind of trouble or any kind of problem with communications, we are also offering a concierge style. That means that you're going to have a patient coordinator available for you 24/7 in case you need anything while you're here. I will show you a little bit of pictures of where of Blue Medical Hospital. It's this blue hospital that you can see surrounded by trees. Actually, the black building that looks right next to Blue Medical Tower, it's the office of Dr. Valenzuela. So we are very close to the actual hospital. I can see it from here from my window. But it's very close. So this is helpful just in case you need something from us or you need something from Dr. Valenzuela directly. That's very close to the hospital that we are using. As you can see in the pictures, Blue Medical Hospital, it's has a very nice setting. It's a very high-end facility, but not only on the comfort of what you can see on the pictures, not only the cleanliness of the floors and not only the size of the rooms, but it also has the highest standard in technology that it's needed to perform a safe bariatric surgery. The level of technology that we have in hospitals like this one is the same as any hospital in the United States or Canada or New Zealand or any first world country. Hospital Blue, as you can see here on the screen on the map, it's very close from San Diego Airport. The line that you can see on screen, it's the line drawn from San Diego Airport specifically to the hospital. You can see it's very close. It's a 25 to 35-minute drive, typically without traffic, which is most of the days. This is something that I usually tell the patients that I'm in touch with. Sometimes it's easier for me to go to San Diego Airport than to Tijuana Airport. San Diego Airport also has another peculiarity. It's an airport that it's within the city. So as soon as you land, it's not a long drive. But regardless of that, we take care of that. Our experience focuses on when you land in San Diego, you have someone already there. And we stay with you until we take you back to the airport. And this is a common question, and this is just, I'm going to start sending flowers our way, but this is why Tijuana and why it's a premium medical tourism destination. And the main thing is Tijuana, it's conveniently located next to San Diego, California, which makes one of the main advantages or why Tijuana has established as one of the premium and top medical tourism destinations in the world. But regardless, or not only focusing on the geographic advantages of Tijuana, but also Tijuana has become a major hub for doctors and for medicine in general, making a very good competition. Almost every hospital in Tijuana, it stays on the highest level of safety and technology standards. A lot of doctors from all over Mexico and all over the world actually come to Tijuana to establish their practice, making Tijuana not only because of the location, a premium destination, but also because of the healthy competition among doctors and hospitals in the city. Like if we want to establish ourselves in Tijuana, we need to offer high quality, a good patient experience to all of our patients. And that's a very good thing, not only for the city, but also for you guys as medical tourists that come to Tijuana and get saving a lot of money, but getting high standard quality for your surgical and your health needs. Because Tijuana, not only it's a destination for bariatric surgery, it's also for a lot of medical treatments. On the screen, you're going to see pictures of Dr. Valenzuela with different patients. This is just to show you exactly the level of care that you get while working with Dr. Valenzuela. Dr. Valenzuela, it's regarded not only for expertise and for her skills, but also she has a very patient-centered approach for you. So she likes to stay very in touch and very on top of everything. Like I was saying, she's on top of everything on the fact that she's right now available on the phone, just making sure that I provide correct information for you guys. So if you have any questions directly for her, feel free to ask me. Sorry, I will go back to my presentation. Okay, so in this regard, we have we have compiled what all-inclusive package. An all-inclusive package, it's a standard package on everything that you will need for a successful and a safe and an effective bariatric surgery. An all-inclusive package means that we take care of everything for the patient and a companion. And when I say everything, it's everything except the flight. So you just need to focus, or you just need to make sure that you arrive safely to San Diego. And as soon as you're in San Diego, we take care of the rest. A typical itinerary for a bariatric surgery, what usually happens with every patient is that you will need to spend 5 days in Tijuana. On the day one, you arrive to San Diego Airport. We pick you up from the airport and we take you to the hotel. You rest of the hotel, and on the next day, it's your surgery day. After the surgery, it's usually recommended to stay 2 nights in the hospital. So you will spend 2 nights in the hospital, and your companion is welcome to stay with you. On the fourth day, you get discharged from the hospital, go back to the hotel so you can rest an additional day. And on the fifth day, you're going to be driven to San Diego Airport to take your flight back home. A little bit pictures more Blue Medical Tower. It's just so you can take a look around of the type of the type of facilities. And also something worth mentioning that not every surgeon has included in their package, it's inhalotherapy. In here, you will get the breathing exercise, but I will get that into lately on everything medically that it's included on your surgery, but it's something that it's not included on every group, in here, at least here in Tijuana, that it's inhalotherapy before, during, and after the surgery. On screen, you just see some real patients, some real transformation of patients that have trusted Do It Bariatrics, trusted Dr. Valenzuela, that they proudly share their progress and with us and also with you. Okay, and this is just Dr. Valenzuela. Dr. Valenzuela has all the credentials, all the expertise, and all the experience needed to perform safely bariatric surgery, and not only bariatric surgery, also general surgery in case you or someone needs it. But her specialty mainly, it's on bariatric surgery and every kind of bariatric surgery, and she specializes in complex revision surgeries. Okay, until this point, have any questions or something that I need to focus on? Feel free to raise your hand or to type it in the chat. Oh, I see that Eunice Opoku has a question. Oh, I'm just waiting here. Okay, you're allowed to talk, Eunice. Nice to meet you.
Hi, yes, nice meeting you too. I wanted to ask because I heard something like your companion can be with you in the hospital on the fourth day. So does it mean I'm allowed to come with a companion? And if I'm allowed to come with a companion, where will the person be during my surgery day and my 2 days stay at the hospital? Is it the cost of you guys to take responsibility of my companion's accommodation, or I have to do it myself?
Okay, yeah, very good question, Eunice. The cost on your package is included for you or for you and one companion. And the companion is welcome to stay with you at the hospital and also at the hotel. So typically what happens is that we drive you and your companion to your hotel. You stay at the hotel. You can ask for a double room or a single room, depending on the relationship with your companion. And then he or she is welcome to stay with you in the room in the hospital. The rooms in the hospital are private, are very big, and they do have a shower and everything available so they can accommodate another person and with no additional cost. All of this for you and one companion is included. The only thing that it's not included, it's in case your companion decides to stay in the hotel instead of going with you to the hospital. In those cases, with for additional charge per night, we can have the companion stay at the hotel.
Okay, I think I'm okay with the answer now.
Okay, thank you very much, Eunice.
And in case I don't also come with a companion, will I be okay by myself if I'm alone in all this traveling in and out? Is it safe or I need to bring a companion?
No, it's recommendable to come with the companion. But to be honest, a lot of people come by this by themselves. It really depends up to you. But yes, you are welcome to come with the companion. But if you decide to come alone, we can also help you with that. If you decide to come alone, nothing will change on the trip or the itinerary. Will be exactly the same. We will be picking you up directly from San Diego Airport, take you or drive you to the hotel, and then in the hotel, take you to the hospital, go back to the hotel, and go back to the airport on the day of your departure. One thing that I forgot to mention, just on this regard, on the transportation back to the airport, is the fact that you don't have to set us to set or to fit our schedule. Our service is personalized, so we don't charge you. Or additionally, if you decide to come very late or very early, that it's completely up to you. But yes, your companion or without companion, it's also fine.
Okay, so that means the procedure is such that I can be on my own without necessarily needing a companion. That's all I want to know.
Yes,
Like I'll be safe all by myself and I'll be fit to fly back home alone all by myself. That's all.
yes. A lot of people come by themselves, and you can safely come to have your surgery by yourself and being driven back home and fly back home.
Okay, okay. Thank you.
No problem. Okay, well, I will start focusing right now on the different type of surgeries, that we offer. Okay, well, bariatric surgery, we can classify bariatric surgery in two ways. The one that is restrictive and the one that is malabsorptive. The types that are restrictive, it's like a gastric sleeve, like the one that we can see on the left on the screen. This is the type of surgery. It's restrictive because what happens is that the doctor surgically will remove a part of your stomach. So your stomach is going to be smaller and you are going to achieve weight loss because the amount of food in your stomach, it's going to be diminished or it's going to be lower in quantity. So you need to focus on the quality of the food that you're going to start to take. The other type of surgeries are the one that it's called malabsorptive. In these cases, it's like the bypass, like the one that you see in the middle, or the mini gastric bypass, the one that you see on the right. That what happens in here is that the food not also it's restricted on the amount, but it also bypasses your stomach going directly to the intestine. In this way, the amount of food not only going to be lower, but also it's going to be not absorptive. So in this type of surgery, it's a little bit more, you need to lead a little bit more careful with the nutritional guidelines after the surgery. So those are the main difference. But obviously with the malabsorptive surgeries that are also restrictive and malabsorptive, you can achieve a greater weight loss at a shorter time. Um, One of the main difference with bariatric surgery with other weight loss options, or not with other weight loss options, but something that you need to consider with bariatric surgery. Bariatric surgery is regarded, and every professional will tell you, it's a tool that you will have to learn to use in order to achieve your health goals. It's not magic. It's not the easy way out because it's not easy. It's going to require a lot of effort from you guys, but it's ultimately a tool. There is a saying that we like to say in Mexico. It's a common saying that when I was in college, it was very common. It says that pilot, a tool, can be used to climb the Everest and also can be used to kill Trotsky. It's by a communist writer. That means that a tool can achieve great things if you learn how to use it correctly. I will focus a little bit more on each of the surgeries. Gastric sleeve, this is what the same image that we were seeing before. It's cutting your stomach, that it's going to be shaped like a sleeve, and it's going to diminish the amount of food that can take. Obviously, when eating less, you're going to feel full sooner, and you're going to achieve the weight loss or the healthy weight loss, uh, restricting the amount of food. This is ideal for patients with BMI 35 and higher, and it's like the most common surgery. It's one of the most effective, and it's also one of the safest, especially in Dr. Valenzuela's hands. The gastric sleeve has two variations. Well, actually has three variations in which Dr. Valenzuela is a pioneer in this one, what we call the TILS, or the three-incision laparoscopic sleeve. That means that Dr. Valenzuela uses only three incisions in your belly, so she can access your stomach and she can remove the stomach and cut your stomach, having a more cosmetic results because you will only have three scars that are very, very small. Instead of a lot of surgeons still use five incisions, but Dr. Valenzuela has a very refined technique, and she is able to do it only with three incisions. And there's also another variation that it's only with one incisions. It's called the single incision laparoscopic sleeve. That means that Dr. Valenzuela will access your stomach. It's only one incision that you can see on the picture on the right, with through only one hole. For this, it's use a special device, and that's why the single incision laparoscopic sleeve, it's the price, it's a little bit higher, but it's not for every patient. So you need to meet certain criteria in order to be a candidate for the single incision laparoscopic sleeve. The other surgery that we can see here on screen is the gastric bypass. The gastric bypass it's a very, and most people don't realize this, it's a very old surgery. It has been used since the 50s of the last century, and it's a type of surgery where the food will bypass your stomach, as you can see on the illustration. It's a restrictive and malabsorptive procedure. It's restrictive because the pouch on your stomach is going to be a lot smaller, but it's also will bypass food. This is also called or regarded as metabolic surgery because offers a lot of additional benefits for people who suffer conditions like type 2 diabetes, and this is recommendable for people that suffer from acid reflux instead of the gastric sleeve. The gastric bypass has a variation as well. It's called mini gastric bypass, and this it's slightly different than the regular gastric bypass, and it's also recommendable to certain to people that meet certain criteria. But Dr. Valenzuela or any of them, one of the medical team here at Do It Bariatrics can help you decide and choose which one can be better for you. And then I can get to what it's called a revision surgery. A revision surgery, it's when it's a surgery that it's performed to correct or improve a previous bariatric surgery. A lot of people experience weight regain, and they decide to go for a revision surgery. So a revision surgery is when you need two surgeries. Sometimes people who suffer morbid obesity already have a plan that the surgery can be or will be done in two steps. So they forcefully require a revision surgery. A lot of people also are using it not specifically because of weight regain, but they use revision surgery because they are experiencing certain symptoms on the first surgery. For example, a lot of people that undergone gastric sleeve surgery, after the gastric sleeve surgery, they start experiencing a lot of acid reflux, and that gastric sleeve need to be converted to a gastric bypass surgery. So sometimes the recommendation, if you suffer from acid reflux, instead of getting the sleeve surgery, it's going directly to the gastric bypass. But on a regular basis, that is what is a revision surgery. The revision surgery, it's a surgery that technically for the surgeon, it's a little bit more complex. So if you are considering a revision surgery, it's always recommendable to choose or to approach a surgeon like Dr. Valenzuela that has a lot of experience and a lot of expertise in this kind of complex surgeries. It's a little bit of what we see. Another common revision surgery is because one of the old bariatric procedures is the gastric band, the one that you can see on screen. That when there was a band placed on the esophagus to limit the amount of food. And with this, it's also happened with the intragastric balloon. It's that they put a device on your stomach. For a lot of patients, this results in very uncomfortable situations. So that's why they decide to remove these devices. So when you have a device or a previous surgery with like a lap band, it's also considered a revision surgery. And that it also needs to be done or needs to be performed by a very highly skilled surgeon like Dr. Valenzuela, because it's technically not an easy thing to remove the lap band, especially because sometimes the band gets eroded in the esophagus. So it's a very complex surgery that you need to focus on the experience of the surgeon in case it's something for you, it's happening. It's also considered a revision surgery when you have a previous abdominal surgery. And this is because if this, like the one that you're seeing on screen, this kind of surgeries make a very complex environment for the surgeon. So that's why it's considered a revision surgery, and there is an additional fee in case you need to have a revision surgery. Um, I will talk now a little bit of the process, but not on, I was focusing before on the process of the whole trip, but now I'm talking about the process of your surgery. Um, the whole protocol that we use, that it's led by Dr. Valenzuela and overseen by Dr. Valenzuela in every step, it's a very it's a process like you will get on any hospital in Canada or any hospital in the US. First, you will have the bariatric assessment, that it's a consultation with Dr. Valenzuela directly. Well, she will review your history and she will explain the surgical plan with you. Actually, when you decide to book a surgery with us, you're entitled to have a one-on-one conversation with Dr. Valenzuela, a video conversation like this one, even before you come here to Tijuana, so you can get to meet her and she can explain specifically what she will be doing on you. But you will get this bariatric assessment. Besides the bariatric assessment, you get also evaluated by an internist or a medical doctor specialized in as an internist, that he or she, the doctor, well, in our team, it's a he, it's Dr. Ortiz. He will determine if you're suitable to undergo bariatric surgery safely. This is done through blood work, to an EKG, medical history and exam, and a physical evaluation that every patient needs to undergo before getting into the OR. Well, I forgot the pre-admission test. It's that you will signing and reviewing all the consent forms, all the privacy policy that we will prepare for you, not in Spanish, on English also, so you can fully understand what you're getting into it. And actually what we do to every booked patient is we send this documentation so you can review it even before coming here to Tijuana. And the other thing that I was mentioning is the inhalotherapy. It's a pre-surgery lung preparation, so they will give you exercise on breathing so you can recover smoothly and easier after the surgery. Um, the transoperative process, it's the whole process that it's done on the surgical room or the OR. It's where Dr. Valenzuela does her thing. In that case, all the in here in the hospital that Dr. Valenzuela uses, it's a hospital designed for bariatric surgeons. That means that the tables and all, it's everything is safe according to the size of the patients that we need. This is special and this is important because not every hospital is prepared for bariatric surgery. Not every hospital has this whole scenario and the whole infrastructure to be prepared for this. But in this case, in Blue Medical Hospital, it's a hospital that we can, or we are very proud about it because we have not only the technology, but it's a full service hospital. And I want to focus, or I want to stop here because not every surgeon uses a hospital. A lot of surgeons, that's why you will see a lot of different pricing among the surgery groups. It's because some surgeons use or utilize a clinic instead of hospital. Um, we like to do it, or Dr. Valenzuela likes to do it in a hospital. And the reason is it's not common, but in case something peculiar happened, the doctors need to be ready and needs to have every tool available. So Blue Medical Hospital is a hospital with an ICU that, well, hopefully, and we'll never use it, but it's ready in case that it's needed. So we can do everything in here. Another thing that happens in this hospital, it's the leak test and the imaging and the labs are in the same building. So you don't have to be being driven around the city to do everything that needs to be done during and after the surgery. And the post-operative process, it's very easy because you need to, well, you will get the inhalotherapy, you will go back to your private room. And this is where the progression begins. And another thing that it's important to mention, um, like I was saying before, bariatric surgery, it's a tool that you will need to learn to use it. And when you use medical tourism for bariatric surgery, um, you have available the multidisciplinary group led by Dr. Valenzuela. And if you can see on screen, a lot of the patients after going back home, they have the right and they have the ability with us to schedule video conference directly with Dr. Valenzuela in case they need anything. Like in here in the screen, you can see our patient Tonya that she was having a video conference with Dr. Valenzuela, but it's something that it's available for you. But why do I mention it, or why do I focus very importantly on this? It's because medical tourism is like the DIY or the do-it-yourself process. In here, you need to make sure that you follow up not only with us, but also with your whole support group back home so you can accomplish your health goals. So thank you very much for listening. Right now, it's the part where I can answer any questions that you have on this regard. So if you have any questions, feel free to ask, and I will be more than happy to answer directly to any of those questions. You can raise your hand or you can type the questions directly on the chat, and I will be more than happy to answer them. Okay, I have a question from Cherry. I will allow just give me 1 second, please. Cherry, yes, how can I help you, Cherry?
Can you hear me?
Yes, I can hear you now.
A lot of the people that I know who have had stomach surgery end up gaining a lot of the weight back. Is there a particular procedure that is better for not gaining it back than another one?
Um, Depends on each case and depending on your health goals. That's not about, it's not about that any procedure offers or a higher weight loss than other. It depends on what you want to accomplish and depends on how much you are going to commit. Bariatric surgery, like it's it's and I will repeat myself, it's a tool that you need to learn to use to accomplish your weight loss goals. That means that you will need to have accountability and be responsible with your surgery after you have your surgery. But it's not, it depends on you and your specific condition. In your case, and to assertively answer your question, what we can do is you can submit your health questionnaire, and Dr. Valenzuela, if you're on the site or you want to have an overview on which surgery will be better for you, in that case, Dr. Valenzuela can review your questionnaire, can review your specific case, and she will recommend which one she thinks it will be better specifically for you.
Asking about dietary requirements. You can or can't eat.
Oh, my husband wants to know, what are the dietary requirements, what you can and cannot eat after the surgery?
Okay, that's also a very good question. The dietary requirements after the surgery, obviously we provide the guide, but it's on stages. Immediately after the surgery, you will go to a liquid diet. That means that you're allowed only to take liquids. After, I think it's 3 or 4 weeks after the surgery, then you move into solid foods. So it's a stage. So practically, what it's better or focus on what you cannot eat. What you cannot eat is mainly like gas beverage, spicy food, and that kind of food that are very aggressive with the stomach. But it will go to a place where you are going to be able to eat anything that you were able to eat before. But it's on stages, or you need to go through a different stages. What a lot of patients have told me, or what I have seen from a lot of patients also, it's that sometimes the taste of the mouth of the patient changes. So a lot of patients sometimes tell me that before they used to like or love chocolate, but not anymore, or things like that. But mainly, the things that you cannot eat are stage, and ultimately you can eat anything, and you need to do and learn to do better choices, or do a better relationship with food. I don't know if I answered correctly.
Thank you. Yes, you did.
Yeah, okay. Yes, yeah, but well, if there's any other specific question that I can help you with, I'm more than happy to do so. And if you have private questions, probably you can, and you all can also send it by email, because sometimes patient wants to have a more private question or more information that is directly to the doctors. I will be more than happy to relay this information to the doctors, or to schedule to any one of you a direct one-on-one conversation with Dr. Valenzuela. Okay, just wanted to, well, to ask you, to any of you, if you have any additional questions that we can address, or any additional information that you need from our side. Probably you cannot think about it right now, but also another thing, it's remember that we are very open, and we are very available for all of our patients. So if you have any questions after we finish this webinar, you can feel free to email them to me. If I don't have the answer, I definitely know the people or the doctors that have the answer for specific questions. Okay, in that case, if there's no additional questions, I will get this webinar finished. I just want to remind everyone that attended the webinar that there is a $250 courtesy for those that want to schedule the surgery during this weekend for attending the webinar. So all of you that already have a price, the $250 discount will apply to the surgery if you decide to go ahead and book the surgery with us. If you need any additional specific information about the hospital that we use, our company, or about Dr. Valenzuela credentials, that is something that you also have the right to ask, and we are more than happy to provide it.
How do we write for more information?
Okay, yes, what I can do is I will put in here in the chat, I'm putting the link to submit the health questionnaire, and I'm also putting my email where you can and the phone number. This is the link to send the health questionnaire. This is my email. It's on the chat, or is Luis as my name?
Session is disabled. The chat session is disabled, so we don't see anything in the chat, and we can as well.
Oh, okay. I'm sorry. In that case, I will give you my email address. My email address is Luis as my name, Luis at doitbariatrics.com. You can send me any questions right there. You can even write directly to Dr. Valenzuela. Dr. Valenzuela email address is dr as doctor, b as her last name, Dr. B at doitbariatrics.com. And yes, and you can have any questions in there, but I will make sure to send you, Cherry, an email right now with the link to the health questionnaire or the information that Dr. Valenzuela needs to determine or recommend what's better for you. And you will receive an email in there, and you can also feel free to ask me any specific questions in there.
Thank you.
No problem, Cherry. I will make sure that to send you that email to you. Eunice, I think you already have my email because we have been exchanging the email before the webinar.
Yeah, yes, please.
Okay, yeah, so you can feel free. I think you have already all the information needed to make a decision. But if you need any additional information, I'm more than happy to provide it.
No, I'll call you tomorrow.
Okay, and Cherry, one another thing that I also wanted to mention that it's because I understand that your husband is involved in the decision, so he can feel free to contact us, and we can answer any specific questions that he may have.
I tried calling today and I got an answering machine. Is there another number somewhere
No, well, the number that we have is the following. It's 619-598-8133. Yeah, but probably what time did you make the phone call? Because it was
middle of the day?
okay. That's very strange because I had but I will make sure to see, or we can call you. I'm seeing here, the day. It's 801, your area code.
Yes.
Okay. I think we missed that phone call, but I can make sure to give you a call tomorrow if you want at any certain time.
Oh, he doesn't want to do that right now, but we'd like to just talk about it.
Okay, yeah, but I will make sure that to have the phone ready.
Okay.
Okay. Well, thank you everyone for joining us. Thank you for those that didn't have questions, but it's the same applies. And Eunice, I will be expecting your phone call tomorrow. And thank you everyone for joining the webinar. And again, the same. If you have additional questions, more than happy to provide it. And hopefully, I get to know you in person very soon.
Thank you very much.
You're welcome. Bye bye.
Yeah. Bye.
What were you doing to talk to him? I couldn't see what you were doing to ask him the question.